Okay. Now we're looking at another classification of nerve diseases. So this is what is known as inflammatory neuropathy. Inflammatory neuropathy. So, trying to define terminologies, right? Inflammatory is something that came in as a result of inflammation. Neuropathy is a disease condition affecting a nerve tissue. Okay, so inflammatory neuropathy is just like, okay, nerve issues that came in because of inflammation. So of course it's not one disease condition. Okay, it's like a classification of different disease conditions. So there are a group of disorders. Okay, so this is where the body's immune system is attacking peripheral nerves. So this leads to a whole lot of pain, okay, weakness, sensory disturbances. Okay, so what are inflammatory neuropathies? They are immune-mediated nerve disorders. They cause inflammation and damage to peripheral nerves. So they can be acute or chronic, and they often involve what? Motor and sensory fibers. Okay, so inflammation. Okay, so inflammation could actually dysfunction the nerve. Okay, how information is passing and all of that. So the most important part of this lecture being, looking at the major types. So I'll look at the types, I'll call the names out, I'll describe how it is. Then you can pause to look at the features. So we have the Guillain-Barré Syndrome. Okay, Guillain-Barré Syndrome. You can see that the nerve sheet is eaten off. Okay. So autoimmune attack, so it's the immune system of the body that is attacking the body. Then we have the chronic inflammatory demyelinating polyradicular neuropathy. Okay, that one is chronic version of Guillain-Barré syndrome. The multifocal motor neuropathy, paraneoplastic neuropathies, that one is because of a cancer that are having issues with the nerve. Okay, vasculitic neuropathy, that one, the blood vessels are affected. So the blood vessels are affected, then in turn it affects the nerves. Okay. Then common symptoms. Okay, what are the issues that patients with this can face in general? So their muscles weak, they are numb or tingling, loss of reflexes, neuropathic pain, they are weak, and their ability to move is not really cool. So diagnosis is just nerve studies, lumbar puncture, MRI, blood test for autoantibodies, nerve biopsies. Okay, so you can treat by what? Intravenous immunoglobulin, corticosteroids, plasmapheresis. That's when you're trying to exchange and take out the bad antibodies. The immunosuppressants, which are basically drugs that will help to calm the immune system down, because in most of this is the immune system that is attacking the body's own tissues.